Respected Shri Amitabh Bachchan ji, dignitaries on the dais, my dear patients who have come from Hyderabad, members of the media, and distinguished guests. We begin with a short film that has been made by Usha Lakshmi Breast Cancer Foundation a few years ago. As you will see from the film, through the medium of classical dance, a breast cancer survivor, a very accomplished survivor, demonstrates the importance of early detection of breast cancer. May we have the film, please? But I consider somebody sitting here, Jayesh Ranjan, who is a very senior IAS officer, the government of Telangana, who is the chief advisor of the foundation, to introduce the foundation to you.
Thank you very much, Dr. Raghuram. Good evening, ladies and gentlemen. It's a matter of great honor to speak very briefly about the Usha Lakshmi Foundation. Of course, we in Hyderabad know about it quite in detail, but since I'm addressing audience here in Mumbai, I would like to give a little bit more information on the genesis of the foundation and what it has achieved over the last so many years. The foundation started in the year 2007. In the Usha Lakshmi, in the name of the foundation, is actually Dr. Raghuram's mother, who herself is a very accomplished medical professional, a doctor, but she was detected with breast cancer, and Dr. Raghuram, who was working in UK at that time, Dr. Raghuram has studied in England. In fact, he is one of the very few Indians who has got fellowships of all the 4 royal colleges in England and Scotland and Wales. He decided to come back and not only stand by his mother, but also ensure that the other people who face this problem of breast cancer, something significant is done for them. So in the year 2000, this great foundation was started in Hyderabad. And many of you would be aware that the incidence of breast cancer is quite high in Indian women. And one of the main reasons for it is, for a variety of reasons, early detection does not take place. Women who fall prey to this problem, this issue, they seldom report about it till it reaches a very, very advanced stage. And it is not really, it's not really very difficult or complicated to go through an early detection process. But knowing the fact that there are social taboos, there are cultural barriers in women coming forward, taking the responsibility of reporting this problem on their own, what we have done in the foundation is to train an army of volunteers, mostly health workers, who go from village to village, who go to all the working class neighborhoods, who go to all the poor neighborhoods and train the women in how do they do this kind of a self-examination by themselves. And once through that self-examination process, if some woman suspects that something could be wrong, then such women are pooled, and then a mobile kind of a camp is organized where further more scientific detection takes place. And in case someone is found to be really facing this problem, then very high level, very high quality treatment, therapy, etc. is done at specialized hospitals. In fact, Dr. Raghuram has built the first purpose-built breast cancer unit in Hyderabad, the first of its kind in our country, so to say. And this entire range of activities, right from the first level of self-examination to the second level of scientific mammography to surgeries, etc., we offer it completely free of cost. And in the last 10 years or so, the outreach of this campaign has been phenomenal. Not only the entire state of Telangana has been saturated by this effort, the neighboring state of Andhra Pradesh also has been covered to a significant extent. And because of the great work which Dr. Raghuram has been done, he has been awarded the Padma Shri a year ago, and he is on the part of the National Advisory Group, which is now propagating this kind of a mass clinical community health programs, not just for breast cancer, but for a variety of other health issues as well. So this is in a nutshell about the foundation. As I said, this has started 10 years ago in Hyderabad, but our interest is now looking at the great success it has achieved in Hyderabad to really replicate this model elsewhere. And we are open to working with any kind of partner organization who believes in this cause, and he would be happy to take it forward. So thanks once again, and we count on your support to really take the foundation activities to next level. Thank you very much.
Thank you very much, Jayesh. My godfather, my friend, my guide, Sri Padmanabhai Garu, is a very accomplished officer, a Padma Bhushan awardee who has served as the Union Home Secretary and has served 5 Prime Ministers. Very few officers serve so many Prime Ministers. And he is currently the Chairman of the Administrative Staff College of India. He has been watching the foundation and my activities very closely, and I request him, I'm very grateful that he has come here to Mumbai. Sir, thank you very much, and I request him to say a few words.
Darling of millions, Shri Amitabh Bachchan ji, whose word is respected, whose views on various things are respected by almost everybody in the country, Dr. Raghuram, media friends, Mr. Jayesh Ranjan, and ladies and gentlemen. There is nothing much I can tell except that as Chairman of Administrative Staff College of India, one of my functions is to see the policy, the public policy and policy implementation. So then I get as he said, a ringside view of what is happening in the country, and especially being in Hyderabad, I see what is happening there. Only 2 points I want to mention here. What is the need for this mobile app? Why is it necessary? It is necessary for 2 reasons. Because breast cancer is the most common cancer amongst ladies. And you know, only about 12.5% of the people go to the doctors at the earliest stages. So that means almost the remaining 88% of the people go at a later stage. 2, the incidence of cancer is very high in America, in a country like America. But the deaths are very few there. Whereas the incidence of cancer is much lower in India, but the deaths are much higher because people go late to the doctors, you know. And another view is, a lot of people think that cancer is a genetic disease. Actually, research has shown that only about 10% of the cancers are genetically related. I mean, that is a prime, risk factor, only in 10% of the cases. In 90% of the cases, it is something to do with the environment,
Bachchanji is with us today, and I really count my blessings that he's here, and I will never ever forget this in my lifetime. So before we move on, I'd like Shri Amitabh Bachchanji to give a bouquet to the person who has helped us to develop this app, Mr. Mahadevan. Please come on to stage to receive this bouquet, sir.
Is really privileged that Mr. Bachchan has chosen to be the chief guest and honor us with his presence for the launch of this mobile app. Mr. Bachchan, as we all know, is a national icon and a role model to all of us, and his endorsement to this cause really means quite a lot to us. So without further ado, I would request Mr. Bachchan to address the gathering, after which okay, we will have the release of the mobile app first, after which we would request Mr. Bachchan to address the gathering.
Dr. Raghuram, Mr. Padmanabhai, Navya, Mr. Ranjan, Pam Auntie. Mrs. Pamela Chopra is family to us, so she's the one that actually drew my attention to this very worthy cause and to this wonderful gentleman who's been working so hard towards this cause. I'm delighted to be invited here today, Dr. Raghuram, and delighted because in the past I have been associated with many medical causes and taking up campaigns that hopefully have worked. We worked for the United Nations for polio, and almost laboring for 8 years, we were able to have a condition where India is today polio-free. I've been working on tuberculosis, hepatitis B. Hepatitis B is a dreaded disease, also working on diabetes. But one of the things that came through with all these campaigns was the fact that no one was able to draw attention to the people that you need to understand what the disease is, to be able to know what it is, to be informed about it. And when these aspects of the disease were brought forward, then the working of the campaign became a lot easier. Having knowledge of the disease is the doctor's job. But the people that suffer sometimes feel that they don't need to consult, or when they need to consult, it has become too late. And therefore, timely intervention and informing the medical profession of your disease, as I have noticed, has been very beneficial. I say this out of experience because when we did polio, we had a lot of trouble convincing the people about taking this dosage, because there were a lot of apprehensions, there was a lot of resentment to the fact that these doses were not actually helping the patients or was going to prevent the child from getting polio. But we worked consistently and were able to convince them. And eventually, as I said, today India is polio-free. For tuberculosis, I joined the campaign because I'm a TB survivor. In the year 2000, suddenly I was detected with tuberculosis. And because I was able to timely inform my doctors about it, or the doctors actually found out about it, and I was able to take a treatment, I was able to come out of my tuberculosis. And one of the things that I keep saying almost with due affection and with due regard and great humility is that if it can happen to me, it can happen to anyone. It's much like what the lady just expressed. If it can happen to her, it can happen to anyone. Tuberculosis is normally associated with people who live in lesser means, in bad environments. So if it could happen to someone who, by the grace of God, has had better facilities and better environments to live in and work in, can happen to me, it could happen to anybody. But timely intervention, informing people that going for detection, putting yourself up for analysis, or just going to a doctor and doing proper investigation was able to save millions of people. The same thing happened with hepatitis B. In the year 1982, during the shooting of one of my films, Coolie, I had a bad accident, and during the course of my hospitalization, I needed a lot of blood, almost 200 packets and bottles of blood was needed. There were almost 60 bottles of blood. There were 200 people that actually came forward to donate blood to me. And one of the donors was carrying the dreaded hepatitis B virus. The Australian antigen virus was something that had just been discovered, and the doctors were unable to identify it. It went into my system, and I didn't know about it until the year 2005, which through a general testing that I was going through was suddenly discovered. And it was discovered that it had destroyed 75% of my liver. What I'm trying to say is that I today survive on 25% of my liver. You can survive liver diseases, I believe, with even 12%. But the fact is that it was detected, timely intervention was taken, and even though I have lost 75% of my liver, I am able to survive and stand in front of you today because proper care was taken at that point of time, and it was detected in time. Much the same is what I've been hearing from all the speakers that have talked about breast cancer. If it is detected in time and knowledge about it is known, you have two very good examples this evening who have told you that they were able to survive and are happy that somebody like Dr. Raghuram was able to take care of them and bring forward all the medical help that was required. I'm very happy that an application today has been devised where people who are not knowledgeable enough about breast cancer can know about it. I was a little apprehensive about it until Mr. Padmanabhaya informed me that what I was apprehensive about was that application is something that is more prominent in urban areas and cities and metros and more so-called educated people. What happens to people in the villages, because the application needs to be understood there. But he now informed me in his speech that the incidence of breast cancer in rural areas is less than what it is in urban areas, and therefore that is very heartening to know. But I presume that there will be some kind of device where the application is brought out to the rural areas as well, and they are educated enough to know how to use them. I saw the app this afternoon. Dr. Raghuram and I met earlier on, and I was delighted to know the various aspects of the application. It gives you information about what breast cancer is, of how it is treated. Sometimes in society it can become a sensitive issue. It can become a topic that is sometimes embarrassing for women. But I feel that you know, one should not feel embarrassed or sensitive about a disease. We're all human beings. We are all susceptible to all kinds of illnesses. And the app actually leads you through various aspects of what breast cancer is, how it can be treated. Post-operative care or post-care is a very important element in most diseases. And as we saw in the application, some of the aspects of how to treat breast cancer after you have been treated are very important. I'm delighted today that I have been associated with this campaign. And Dr. Raghuram, may I just offer my services, my voluntary services to this wonderful campaign. If in the future you would require to use my face and my voice towards this campaign, I shall be more than willing to help you. Thank you so much.